think this project has come about in many ways because of the experience of what quite a number of us involved in the project have seen across Europe. And through our work and experience, we've seen that this is something which absolutely fits with opportunity and needs in an Irish context, whether it's within Northern Ireland, Republic of Ireland, in the region.
Social farming had emerged across Europe in similar settings to where it exists within services in Ireland. It's used in the context of particularly people with intellectual disabilities. There's always been an affinity of using horticulture and working with animals in that context. It's very prevalent in terms of supporting people who are recovering from mental health, drug and alcohol recovery, probation services. Really, there is no limit. Older people, younger people, disaffected youth are all very significant areas of activity across Europe.
One of the things about social farming is we're not out to try and say social farming works. We know it works. There is a long history of it working very effectively. It's much more about trying to position social farming in an Irish context.
The Leitrim Development Company was involved in the SOFAB research project. It was a European research project which was looking at the evidence where social farming activity happens. The role of the company in County Leitrim then is to advance rural development, social inclusion and community development, both in terms of economic, social, cultural development. And we target those people who are most in need of support.
Queen's University were involved in this project right from the very start, from the inception, through the planning of the concept behind social farming, how to get people involved, get the project up and running. Social farming comes into a rural development context in terms of the continual need for farmers to diversify and to look for other aspects of farm income, activities and so forth. So it's not just purely a monetary aspect of increasing income to the farms, but a desire to help others that has come from the community.
The rationale was to put in place a pilot which tested where are the barriers, and then to work out how to address these barriers, to negotiate a way forward.
The HSE new policy, which is called New Directions, it outlines the future of HSE funded adult day services. Those choices will be based on what an individual wants, so they'll be person-centred, based on a quality service, very much based in inclusion within the community. And the social farming project really offers that because the farms obviously are at the heart of many communities, and therefore I think it hits all the buttons in New Directions.
One of the benefits of this programme is that it's community based. And under Vision for Change, we run a recovery model, try to give people choice, but also to keep them in their community so that they don't have to travel to the large urban centres, to Donegal town, to Letterkenny, to attend a day centre. They can attend Blissbury Farm or whatever that's in their locality.
We had developed a model of day opportunities for adults with disability, using horticulture, animal husbandry and environmental projects. One of the things that we found that while we were giving people knowledge and skills, we weren't able to sort of move people on, and everyone needs to develop to their potential. So I strongly believe social care farming provides that opportunity for people with a learning disability, but it is also mutually beneficial to the farmer and to the community in its widest sense.
It's been a new experience for people. It's been a stepping stone, some to even think of working, some getting involved in healthy activity, for other people thinking of moving into more independent living.
Well, the pilot has been very helpful in raising awareness and really has brought, now that we're coming to the end stage, brought some of those challenges to the fore. And the question is, how will it be made sustainable? Like any good ideas that are new, the lead-in time to get it up and running needs to be considered. And I think this is about cultural change. It is about doing things differently, and that takes time.
Social care farming, to progress, has to be a partnership relationship. The partnership, the farmer is private. The statutory services have responsibility for assessing the needs and meeting the needs of people with a disability. So we very clearly have to meet in the middle.
We need a framework to bring those organisations with an interest together. There needs to be a lead and there needs to be a coordination of all of that to ensure that the appropriate agencies and the appropriate organisations are at the table.
I guess when I first engaged in this project, I really knew very little about social farming myself. And what I've learned is it's an ordinary farmer on a farm providing an opportunity for people to go to. And it is as simple as that. And it's made more complex by the individual's needs and matching those. So it's about finding the right fit for the service user and the farm they're going to.
So far, the project has been a success. The measurable outcomes associated with everything that we've set out in the project is in the main being met and achieved. And from a research perspective, to draw those threads together into a policy whereby social farming can be seen as an alternative to various aspects of work and activity within the farming rural area, I think that is key to the ongoing nature of the project.
I think going into the future, and certainly arising from the initial discussions that we've had with the health services on both sides of the border, they see the strength that's in the capacity of local farm families, local families in the community being partners, real partners, and actually delivering the choices that people are asking for. I think there's a key inherent strength that comes from families who are embedded in the community playing a role of supporting other people who come from that community. And whether you're in your late teens or your 20s or later in life, you're connected with a family. So that natural bond that happens between one family who has a family member who needs support and another who's actually able to provide some of that support, I think is one of the key strengths that's there, and one of the things that we're hoping to actually and aim to actually build on.
So the outlook, I think, is very positive. We do have to keep in mind that, Europe is already convinced. When I say Europe, the European Union and its support and its interest in social farming is already convinced on the value of social farming, the worth of social farming to the people who participate and also to the farmers who deliver the services. I think the outlook in Ireland, in the region where we're working, is an outlook which is, it's building up momentum, and we're doing everything we can to make sure that momentum carries us over the line.